Hello, my name is Rose Riley, and I'm a member of the League of Women Voters of Washtenaw County. Welcome to our online candidate forum for the November 8th general election. The League is a nonpartisan, nonprofit organization that promotes voter education and participation, and we host candidate forums to help voters make informed choices. Now, let's hear from the candidates.
Good evening. My name is Carolyn Madden, and I will moderate the forum tonight. It's my honor to introduce one of the three candidates running in the November general election for Washtenaw County Board of Commissioners, District 5, Democrat Justin Hodge. The other candidates are Republican Brett Burke, who declined the invitation to participate in this forum, and Independent David Major Sr., who did not respond to numerous invitations to participate in this forum. But thank you, Mr. Hodge, for participating. We're now ready for your opening statement, Mr. Hodge.
Thank you. I want to thank the League of Women Voters for holding the forum. I really appreciate the time, especially since it's just me. So I'm Justin Hodge. I'm a lifelong Michigander. I'm a social worker, and I'm a licensed master social worker and a professor of social work at the University of Michigan. And my focus on promoting social justice and equity has been what I brought to the Board of Commissioners during my first term. And I'm running for re-election to continue the work that I've been doing to expand opportunity for all residents of Washtenaw County, and specifically working to improve District 5. I'll just go to the questions now. I know I want to get as many of those as I can.
Yes. So the first question is about the use of federal funds. Washtenaw County will receive more than $70 million in federal American Rescue Plan funds. In July, the University of Michigan's Poverty Solutions Center evaluated Washtenaw County's use of these funds. The U of M report recommended that the county prioritize adequate one-time investments in a limited number of initiatives, rather than spreading funding too thinly among multiple programs. The report also recommended a focus on achieving specific measurable goals. Is the county spending ARPA funds as recommended by the U of M report?
So I really appreciate this question. I had a conversation with the researchers, I think a news article where I was asked about the report. I've been very involved with how we've allocated the ARPA dollars as we've gone, and we've really been focused on making one-time investments that will lead to generational change. So I'll talk a bit about that. So we've, as of our meeting last week, we allocated what we call the third Washtenaw Rescue Plan package. But to talk a little bit about the work that we've done with the first two, and then that third one, we've looked at ways to really promote equity and a large focus on health equity and disrupting generational poverty through some of the work. I was really happy that one of the initiatives in the first rescue plan package was work that I was pushing before I got elected to start a countywide children's savings accounts program. So this is a program where we're jumpstarting it as the county, and we'll identify structural funds to maintain the program. But what this will do is it will open up college savings accounts for all kids in Washtenaw County public schools. And I really wanted equity to be the focus of the initiative. So what we did is if kids receive free or reduced lunch, we're going to be able to put a $500 seed into those accounts. So we're going to continue to seed and work with get those accounts going. But we use the ARPA dollars as a way to jumpstart that. Thinking about a specific one-time use category of spending that we did was to close the digital divide in Washtenaw County. The county had been engaged in a number of studies to figure out what can we do to ensure that all residents in Washtenaw County have access to high-speed broadband internet. As part of that first rescue plan package, we allocated funds to connect the remaining households, and that work has already started. We've already started to connect households. So that'll be a one-time use fund. This is a pretty big question. I'm already starting to run out of time on it. But yes, we have been thoughtful about how can we invest in one-time activities to make generational and transformative change, but also how do we use the funds to jumpstart longer term activities that we will use structural funds to continue supporting.
Thank you very much. Question number 2 has to do with safe drinking water. 2 chemical spills, PFAS and Chrome 6, have endangered drinking water in the county. What steps should the Board of Commissioners take to ensure safe drinking water for county residents?
we need to remain vigilant to make sure that we are upholding high standards for environmental quality. So we have an environmental health division within our health department. I've been a huge advocate for our public health department. For my first year in office, I chaired our board of health, and I've continued to maintain that as one of my committee assignments. And I had served on our board of health before I got elected too. So making sure that we are appropriately funding our health department, and specifically making sure that we're getting funds to our environmental health department. But also we need to make sure that we're partnering with Eagle at the state level and staying in close contact with our federal partners to make sure that we have appropriate funding and that we're leveraging all of our partners at all levels of government to make sure that we protect our environment.
Okay, thank you very much. Next question has to do with election fairness. Do you believe that Washtenaw County operates free and fair elections? What additional steps, if any, should be taken to secure election processes and ensure public confidence in elections?
Yes, I believe Washtenaw County operates free and fair elections. I think part of our success in that is that we make sure that our clerk's office is well funded and that our clerk's office has the resources that they need to be really successful in that work. We also lean into making sure that we support initiatives to expand voting rights. So I'm really excited about the ballot initiative that we have this year and the one that we had before. Where can we improve? Because there's always room for improvement. Is that while Washtenaw County government itself, I'm sure does a fantastic job on elections, we have many cities and townships across Washtenaw County, and in Michigan we have a decentralized elections system. So making sure that we are working with the clerks in the cities and townships and working and providing resources to them and support as needed, and making sure that we're working closely with them on a shared vision, which might differ depending on the clerk in the city. And I know that Legal and Voters, I believe, works on some of those clerks projects, which is really important too.
Okay, thank you. Question number 4, the after effects of COVID-19. The COVID pandemic disproportionately affected Washtenaw County's least privileged citizens, especially those living in zip codes 48197 and 48198. Are there additional steps the county should take to address the effects of COVID on these residents?
Right. So as you know, I represent District 5, which is most of Ypsilanti Township and all of Augusta Township. So I represent a large part of the 48197 and 48198 zip codes. So much of my focus, especially when I first took office, was at the height of the pandemic. That's one of the reasons why I work so closely with our health department to ensure that we had a strategy rooted in equity to make sure that we were supporting the residents hardest hit by COVID. Something else that I was able to do in my first 100 days in office was to get us to pass a resolution that commits us to using the Opportunity Index, which is a tool that we have that maps opportunity across the county, across a number of different dimensions, including health. The resolution that I got us to pass commits the Board of Commissioners, county administration, and departments to consulting and using the Opportunity Index whenever we make policy and programmatic decisions. So that's a way for us to make sure that we're targeting resources in the areas most in need. Since then, and thinking about the ARPA dollar question earlier, we've done a number of things focused on targeting the 48197 and 48198 zip codes, including launching what we've called the Community Priority Fund, which was an $8 million allocation focused specifically on providing services into the low opportunity areas in the county per the Opportunity Index. And much of that is focused specifically on 48197 and 48198. So in addition to that, we also committed funding using ARPA dollars to increase our health department's capacity to do health equity focused work, which includes hiring more community health workers that will be embedded in communities that need that. And much of that is in the 48197 and 48198 zip codes. So we're doing a lot of that work, and we're going to continue to do more. I want us to continue this trend that we've started, and that we're figuring out ways to deliver services directly to people instead of having them have to come to a county location. Many of you may be familiar with our health department's mobile services or mobile RV. It's a clinic that we've used to distribute PPE and do vaccinations, but I worked for us to commit funding to be able to use that to do other health department services. I'm running out of time, but that's the direction I want us to continue moving in.
Okay, thank you very much. The next question is county worker pay. Recently, some Washtenaw County employees went on strike demanding higher wages. A 2020 compensation study for the county found that county worker pay lags 7 to 12% behind market wages. What should be done by the Board of Commissioners to address the issue, and how would you pay for it?
Yes, so a lot of this revolves around the compensation study that we did, which we refer to as MAG. It's an acronym. And what we did at a recent meeting is we voted to implement the MAG compensation study to increase wages for our employees. We ran into some challenges in the logistics of implementing that. Originally, our plan was to try to implement the study across the whole of the county organization at once. That was not working out so well for us because going through the bargaining process and negotiations, it happens at a different rate for the different labor unions. So we did at at a recent meeting was change it so that we could implement the MAG salary study as units sign on to accept it. And I can tell you that now the process that we're moving forward, people are going to start seeing increases in their pay by the middle of October. I actually just had a conversation about this today. So we've already allocated and set aside the funds to increase wages. And we know that the salary study in many ways is out of date because it was done before the pandemic. So we're going to continue working to raise wages. We just need to get past this first step of implementing the salary study that was already completed. And people are going to start seeing increases in their pay in October. We're going to continue to figure out how do we get our county staff to market rate.
Thank you. And the last question is about healthcare workers. Some county residents who are mentally or physically disabled qualify for in-home health workers paid for by Michigan Medicaid or Washtenaw County Community Mental Health. A study by public sector consultants reports that these home care workers earn less than $12.50 an hour. Industry groups estimate a current shortage of 36,000 home care workers in Michigan. Is there a role for county government in addressing this shortage? If so, what is that role and how should it be funded?
One thing I always appreciate about these Legal Women Voters forums is the questions are so good and very specific. So with this one, there is a role for the county to play, but unfortunately with it being a Medicaid focused system here, the state needs to make some changes. What we've done is continue to advocate to our partners at the state to increase those reimbursement rates. We actually had a conversation about this a couple of meetings ago too, and that really that's the position that we're in because of challenges that we have with differing opinions at the state level. We'll continue to advocate to our state partners to commit more funding to make sure that we can increase those wages. And we'll continue to try to think creatively at the county level on what we can do. Unfortunately, there are literal barriers for us being able to make significant changes in that. But we're looking at ways that we can continue to partner because these services are critical. I know as a social worker, I used to provide home-based child and family therapy and case management to kids and adults with developmental disabilities. So I know how critical these services are. And really what we need to do as a county is continue to advocate at the state level to make sure that we can get those reimbursement rates increased.
Thank you very much. And now you can make your closing statement.
All right, well, I appreciate everyone's time tonight. I would invite you to learn more about the work that I've been doing at the county on my website at votejustinhodge.com. I'm very focused on continuing to promote the health, wealth, and safety of our residents. Didn't come up in tonight's questions, but a big focus of mine has been combating gun violence. We've seen a significant rise in gun violence in the eastern part of the county, specifically in my district in Ypsilanti Township and some in the southern part of the city of Ypsilanti. A lot of the work that I've been focused on is getting us to allocate resources to ensure that we're providing more opportunities to youth and providing direct intervention to improve community safety. That, along with the other work that I've done, such as to work for us to launch a financial equity center and to continue increasing the health equity focused initiatives of our health department, will both, one, help the residents of my district, but also I have a vision for moving the entire county forward. And that's the work that I will continue to do if I have the honor of being reelected on November 8th. So I would ask for your vote. I would ask for you to learn more about me and the work that I'm doing at votejustinhodge.com. And if you are so inclined, we could certainly use campaign contributions, which you can do that at the website too. Thank you.
Thank you very much. Appreciate your participating tonight.
Thank you for having me.
The League thanks the candidates and volunteers who participated in tonight's forum and community members who submitted questions. Please urge others to view our forums. Most importantly, please vote in the November 8th general elections, either by absentee ballot or in person.